Bueno, tendremos la oportunidad de hacerles alguna pregunta si queréis tanto al doctor Evans como al doctor Legius. Lo que sí que os pediréis es que levantéis la mano y habrá un micro porque necesitamos que les puedan traducir la pregunta. ¿Tenéis alguna...? ¿El micro lo tenéis por algún sitio? Un segundito y tenemos el micro. ¿Sí? Bueno, aprovecho mientras viene el micro. Aquí viene una pregunta. Mientras viene el micro, a daros las gracias por la acogida y pediros disculpas, porque la verdad es que el lunes teníamos menos inscritos y pensábamos que con la sala teníamos suficiente y ya veis, la respuesta ha sido masiva. Bueno, pues tenemos la primera pregunta.
I wish I was a mouse.
Okay.
How do I get access to kind of studies if I want to participate? How do I do it?
Okay, I think that la pregunta, por si alguien no la ha oído, es: ella desearía ser un ratón y quisiera saber qué puede hacer ella para poder obtener estos tratamientos. Cualquiera de los dos que estáis en la mesa. They want to be a mouse.
Well, I mean, treatment trials are things that have to be set up properly. So what I have described to you is not a treatment trial. It is accepted treatment in England that is funded by the government in England. So that is not something that would be available to people outside England. That is not a trial. It's a proper treatment. So we can't give access, unfortunately, to Avastin treatment to people outside of our country. That would have to be funded by your governments. In terms of access to trials, well, that trial has to be working in your country, or you have to apply to go to the country and be treated in that trial, which would mean actually living in the country almost certainly to have that treatment. And I think that's proven difficult. Most of these trials are based in the United States, where there is extremely good funding through the American Army, through the State Defense Service. They fund neurofibromatosis to a very large amount every year, and specifically that has funded a lot of studies. So you would need to ask the principal investigator of the study in the United States whether or not they would take people from outside the United States. We are hopeful, and one of the reasons for forming this group is to develop clinical trials for neurofibromatosis in Europe, so that we can run trials ourselves and hopefully get European money to fund those trials. But you know, that is a little way off at the moment. I don't know, Eric, if you'd like to. Yeah.
Oh, el micro.
In Spain, we have this thing we would call compassionate use. With the results you have, would you suggest we use that way of giving access to the patients for that medication?
Yes, I mean, certainly I'm talking about Avastin use for NF2. I think that would be a route to go. You would probably have to show that any other treatment, which would be standard, such as surgery or radiation treatment, would cause more harm than actually having the Avastin. So they would probably want to show that, for instance, if you were treating the second side for a vestibular schwannoma, that using surgery or radiation would make you deaf, and that having the Avastin would have a very good chance of keeping your hearing. So that is the sort of approach you could do to get compassionate treatment. But obviously, these things are done on an individual basis, and I obviously couldn't guess whether they'd say yes or no in any particular situation.
And just a question about, you didn't talk about segmentary neurofibromatosis. How, I'm not much interested in trials, of course I do, but maybe in the process of this kind of neurofibromatosis. Thank you.
So the segmental neurofibromatosis is a form of neurofibromatosis type 1 where you have cafe-au-lait spots and or neurofibromas on one part of the body. So on the left side or the right side, the upper side or the lower side. And it is caused by a mutation in the NF1 gene that is only present in part of the cells. So it is not a mutation that has been inherited from one of the parents, because at fertilization the egg and the sperm cell have normal NF1 genes, but only after fertilization, when there were already several cells present, in one of the cells an error occurred in the NF1 gene. And then only those parts of the body that were made starting from this particular cell will have the symptoms of neurofibromatosis type 1. And if we have 100 people with neurofibromatosis type 1, there are always a couple, 2, 3, or 4, who have this segmental type of neurofibromatosis type 1. So it is usually much milder because it affects only a part of the body and not the complete body. And very often these people do not transmit it to the offspring, to their children, but sometimes we do see that also the cells that make the eggs or the sperm cells, that also these cells are affected. And if such a person transmits this mutation to the children, then they will have it in all the cells, and they will have the classical type of neurofibromatosis type 1. So there is a risk of transmitting it, but it is lower than 50%. Because normally in NF1, if you have NF1, you transmit the mutation to 50% of the children. So there is a chance of 1 in 2. Now, if you have a mutation, you can look at it, but most of the time, in a segmental case, you don't find the mutation in the blood, because the percentage of blood cells is so small that the mutation disappears in the background, and you don't see it. So in order to find the mutation, you then have to go to the cells where you know that they are certainly affected. And this can be a neurofibroma, or the melanocytes, so the pigment cells of a cafe-au-lait spot. But that requires specific expertise to look in melanocytes and to look in the Schwann cells from a neurofibroma. And this is kind of research to do that, so it's not a generally available technique that is easy to do and that is present in every lab. But if you have access to this kind of technology, then it is possible to find the NF1 mutations, and then it is possible to check if this mutation has been transferred to a fetus during a pregnancy. But otherwise, if you don't have the information on the NF1 gene, you cannot do any test during a pregnancy.
And you can get a similar segmental involvement in NF2 as well. Although typically in NF2, when you have a low level of the mutation in the body, it gives you almost a classical type of NF2. But in some you do see this segmental involvement, just involving an arm or part of the spine or another part of the body.
So it's not possible to have a diagnosis until you have a neurofibromatosis?
Yes, to make a diagnosis, you need to analyze affected cells. And just taking blood, you don't know if there are affected cells in the blood. Just take part of skin that looks normal, you don't know if they're affected, you have to go for a café au lait spot or a neurofibroma.
So in NF2 we've found more than 70 patients that are what we call mosaic. By looking at the tumor, seeing that the mutations are in the tumor but not in the blood. So you've proven that it's not, it's at a low level in the body and is predominantly in areas where you get the nerve tumors forming.
Mi pregunta era de que estos tipos de medicación que se están ahora haciendo ensayos, ¿valen para todo tipo de fibromas, tanto internos como externos? ¿Para todo tipo de órganos, como el corazón, o no? Para disminuirlos.
So the drugs that are currently used in trials are specifically targeted towards what they call plexiform neurofibromas, and these are large neurofibromas that are usually present already in children and then grow in children and then grow a lot slower in adults. So most of the growth is in childhood, and so most of the individuals that are in such a trial are older children. For the cutaneous neurofibromas, there are no trials at the moment, and for other organs that can be affected, such as the gastrointestinal stromal tumor in the intestine that I showed, it's just surgery. There is no drug available at the moment to treat this, and also the tumor of the adrenals should be treated with surgery. Glomus tumors should be treated with surgery. It's usually targeted to a very specific kind of tumor and usually in a specific age group.
El micro me parece que no va.
First is if simvastatin, regarding simvastatin clinical trial, if it's, do you know if it's a dose inefficacy related, or maybe if it's a drug inefficacy because it used simvastatin instead lovastatin?
Yes, at this moment there is another trial using lovastatin. That is a trial that was coordinated in Australia, where the trial, so the people stopped taking the drug somewhere at the end of May, and then in June they have collected all the data in the United States, in Australia, and now they are analyzing the data. But we don't have data yet on lovastatin, so it is possible that lovastatin has an effect where simvastatin did not have an effect. We don't know the data yet, but within now and a couple of months we should know if the lovastatin trial was effective or not. There are many reasons to come up or to explain why it works in mice and not in humans. But we don't know at the moment which of these reasons is correct.
So one of the questions as well is, were they treated early enough? So one possibility is you need to give the drug earlier, and there is a trial in the UK to treat a type of autism spectrum disorder by giving the drug at a younger age to see if that has an effect on that type of behavior. So we will see whether the simvastatin works in that setting.
You mean if before a cognitive impairment is?
Yeah.
And the other question is we have a child with a sporadic mutation in NF1. It's possible to have a child with the same mutation.
It is possible, but the chances are very small. So there are only very, very few cases described where both parents do not have any sign or symptom of neurofibromatosis type 1, where both parents do not have the mutation in the blood, and where they had a second child with the same de novo mutation. Everything is possible in medicine, but it is very unlikely, and we consider the risk as being much less than 1%.
It is the same in NF2 as well. In fact, you only need a very low amount of the mutation in the neural crest in NF2 to get tumors, and so the likelihood of not having any manifestation and it not being in the blood and having two affected children, in fact that has never been published yet. There have been one case that was published with two children from an unaffected parent, but that's never been investigated properly in terms of scans or blood tests on the parents. So in NF2 it's probably even lower to have two affected children from an unaffected parent where the mutation was not detectable in blood.
Thanks a lot.
It is clear from your presentation here and the presentation that you had yesterday that the quality and quantity of data available for you is extremely important for you to get results and statistics. What could be the role of individuals and associations to help you in this research?
Well, I think it's always very helpful. I think the association in the UK, what was called LINC, that became the NFA, that is now called the Neuro Foundation. I don't know if we've got any representatives of the Neuro Foundation here, but over the years they have been extremely helpful in galvanizing patients and families to take part in research and to be involved. And I think associations have a very vital role to play. They were quite pivotal in developing the national services both for NF1 and NF2 in England, and we've seen the results of that in what I've just shown you. So without the association, I'm not sure any of that would have happened.
So the associations can help inform patients that a certain research institute or a hospital is performing a trial and are looking for individuals to participate, and then everyone can decide for themselves if they want to participate or not. And this is for clinical trials, usually with drugs and so on, but there are also other studies performed where they look at the growth of tumors just by taking serial MRIs, and where once in a while people are asked to have a scan taken just for scientific reasons, not because of any illness in the patient. And then another way how patient organizations can be helpful is to inform the members of the organizations that certain researchers are looking for tissues, because when people go to surgery they remove material, and this material, these tumors or these tissues, are very important for researchers to study. So finding out where people are doing research and where tissues can be sent to so that they are put in a biobank, and that researchers have access to these tissues to do all their experiments, is very, very helpful. And another thing is that a lot of the information that we have right now comes from research in mice. And I don't know how it is here in Spain, but in Belgium it becomes increasingly more difficult to do research on mice, because people are opposed to it. And this is not of benefit to anyone with NF1. And we only hear those people that like mice and say, okay, you cannot do anything in a research setting. If you have mice in your basement, you kill them. Yeah? We cannot do that for research. We have to write big books saying what we are going to do, how we are going to anesthetize the animals, how we're going to make sure that they don't have any pain. That costs an awful lot of money, and it virtually makes it impossible to do this important research. So we also need people who say we want animal research because we benefit from it. So these are 4 important things that patients could do.
Si nos importa.
In this sense, I would suggest that one of the scope of the new group, European group.
Wait a moment. You need the microphone. It's not. It cannot be translated, please.
Can we suggest that one of the scope of the new group that you are founding now is to improve communication between your group and the associations? Because in most of the cases, association doesn't know exactly what you are doing and cannot transmit this information to the
Absolutely.
management.
Absolutely. That's vital. Yeah.
Si nos importa, tenemos que dejar que tanto el doctor Legius como el profesor Evans suban arriba a la parte científica y pasaremos a la siguiente presentación de la doctora Lázaro. Si no, les daría un gran aplauso por lo que han hecho.